Cuticular drusen are a subgroup of macular drusen. Now, they do tend to start out at an earlier age, but it does set patients up for complications later on in the life. Now, if you think about it, cuticular drusen occur over a widespread area of the retina, not just in the macula. Also, patients with cuticular drusen share some same genetic mutations as other patients with a standard kind of macular degeneration, but they don't have a specific genetic mutation of their own. You should not be surprised that they can have a variety of complications related to the function of the RPE and Bruch's membrane complex. Some of the complications associated with cuticular drusen are pigment epithelial detachments, serous retinal detachments, choroidal nevascularization, and also vitelliform lesions that you normally do not get with standard macular degeneration, and geographic atrophy, usually as the vitelliform lesions change over time. So first we'll start with pigment epithelial detachments. They can be seen in younger patients, and many times they tend to be stable. I think you have noticed that RPE detachments in 20 and 30-year-olds, yes, they can be associated with central serous, but they can be stable for a long time. The pigment epithelial detachments in patients over 50 tend to be more aggressive and more dangerous. This is a 38-year-old gentleman who was told that he had signs of macular degeneration. So when you do see that or get a patient referred if they're under 50, be aware it's not going to be the standard type of degeneration. Clinically, you can see the yellow lesions in the pigment epithelium, but I would be hard-pressed to call anything else just based on the color photographs. His vision was 20/30 in both eyes, and a year later, vision was the same. So if you look at the fluorescein angiogram, you can see far more cuticular drusen than you could see clinically. And you may have been able to see these at the slit lamp, but certainly not on the photograph. So this patient would have type 1 cuticular drusen, but also you can see the pooling of the dye in his various pigment epithelial detachments. The OCT demonstrates the pigment epithelial detachments quite easily. They're very noticeable. But if you look closely, there are many, many cuticular drusen throughout the macula as well. Now, I didn't see him, but I did call the patient 7 years later. He said that he still had the same distortion, but it had not changed over 7 years. Serous detachments is a rare and unusual complication to cuticular drusen. I could find only one other case that was reported in the literature, and this patient had bilateral serous detachments. That patient had a PDT treatment in one eye, but not the other one. Here's our patient. She's a 63-year-old who had noted a film over the vision for the past year. When I saw her, vision was 20/30 in both eyes. Clinically, there were multiple small drusen and medium drusen, and possibly a small pigment epithelial detachment inferior to the right fovea. The fluorescein angiogram shows the multiple cuticular drusen. The left eye was similar, but also not only did she have the cuticular drusen, but there was some hyperfluorescence both above and below the fovea. The inferior pooled dye as one would expect in a pigment epithelial detachment. And here is her OCT, and indeed, that little creamy area that we saw clinically is a small pigment epithelial detachment, and there's also a serous elevation of the photoreceptors. So our thought was, if there is this subretinal fluid and the pigment epithelial detachment, we really did need to look for choroidal nevascularization or a plaque you can see sometimes in central serous choroidopathy. an ICG was done, and neither a choroidal neovascular membrane was noted nor a choroidal plaque. Just as with normal age-related macular degeneration with patients with drusen, these patients also can develop choroidal neovascular membranes. Here is a 73-year-old patient of mine. She'd been having blurred vision in the right eye for several months. On the clinical photograph, you can see the loss of choroidal markings inferior to the fovea and a small subretinal hemorrhage. The fluorescein angiogram shows a classic pattern or a type 1 choroidal neovascular membrane. But if you look closely on the bottom right fluorescein photograph, she does have the cuticular drusen. The fellow eye of the same patient is recorded here. She had no symptoms and her vision was 20/25. If you look, you can see the cuticular drusen scattered throughout the macula and also nasal and superior to the nerve. And here's the fluorescein angiogram of her asymptomatic 20/25 eye. You can see the cuticular drusen quite easily in the macula, but she has extramacular choroidal neovascularization both above the nerve and supranasal to the nerve. Now, if you think about it, the problem with the cuticular drusen is they can be not only in the macula, but spread outside the macula, so it is not a surprise that this Brooks membrane RB complex could not break down and patients have choroidal neovascularization elsewhere. Here we have a 46-year-old female who's had blurred vision in the left eye for 2 months, which got worse in the previous 3 weeks. Her vision in the right eye was 20/20 and the left eye 20/50. The right eye has the classical cuticular drusen not only in the macula, but also superiorly and nasally. The left eye has a deep creamy white lesion near the fovea. The differential should include a serous detachment, an early vitelliform lesion, or a choroidal neovascular membrane. Now, obviously, when you look either at the clinical picture or even with the OCT, keep in mind the clinical picture and the history. And in this case, blurred vision for 2 months, but there's a rapid change, so that may change your thought process in helping you differentiate between these diagnoses. And here is this patient's fluorescein angiogram. Going from the top left, top right, and then down, you can see an early hyperfluorescence surrounded by a dark hypofluorescent ring. Now, this is fairly typical of other styles of classic nets if you've gone through the fluorescein atlas. As the angiogram progresses, the cuticular drusen become more prominent. That goes along with the clinical diagnosis, but also the membrane becomes more hyperfluorescent and has a fuzzy border. And just for a quick reference, here is the late phase angiogram of both eyes. The initial OCT of the left eye shows the choroidal neovascular membrane and also some interretinal cysts. This patient was started on monthly anti-VEGF therapy, and 2 years later, her vision had returned to 20/30, and you can see flattening of the choroidal neovascular membrane and resolution of the interretinal edema. And here's the color photograph that was taken several years later, and it does show a little fibrotic neovascular membrane surrounded by some hyperpigmentation and the cuticular drusen. The OCT shows before and after as well. Vitelliform lesions can occur with cuticular drusen. If you take away the cuticular drusen, the vitelliform lesions could look like that you would find in type 1 pattern dystrophy. The main thing is, don't be confused between a vitelliform lesion and a choroidal neovascular membrane. They can look very similar. Now, if a patient does develop these vitelliform lesions, Barbara Zetto and all reported that 25 will progress to atrophy in the area of the vitelliform changes over a period of time. They also screened patients for the standard genes of ABCA4, VMD2, peripherin RDS, and complement factor H. They did not find any genetic markers in their patients any different from the normal population. Here's one of my patients. This is a 50-year-old female who's had trouble reading over the past 2 years without any sudden changes. Her vision is 20/20 in the right eye and 20/50 in the left eye. The right eye has a non-contributory peripapillary pigment crescent and cuticular drusen in the temporal macula. Now, over the 12 years I've been following her, this clinical picture has not changed. The left eye has a large vitelliform lesion just inferior and infratemporal to the fovea. Now here's the angiogram of this patient. The right eye shows the typical pattern of cuticular drusen hyperfluorescence. The left eye also has the hyperfluorescence, but early hyperfluorescence of the vitelliform lesion. If you look at the mid and the late phases, this hyperfluorescence remains about the same and does not expand as you would think with a choroidal neovascular membrane. Now let's watch and observe the evolution of this vitelliform lesion. The top left photograph was taken in October 2008 on presentation. Her vision was recorded at 20/40. A year and a half later, the upper right photograph was taken. Her vision was still 20/40, but you can see the vitelliform lesion is smaller and the color has changed. It is not as yellow and it's a little bit more orangey. The cuticular drusen are stable. Now, the patient returned 4 months afterwards and said that her vision in the left eye was fading. And indeed, the vision had dropped from 20/40 to 20/60, which is the bottom right photograph. You can see the vitelliform is now fading, and there's a bit of atrophy and pigment metaplasia. The bottom left photograph was taken 10 years after the first. You can see that the atrophy is enlarged to the area of the first vitelliform lesion and has actually got a little bit more so. There's a combination of RPE atrophy as well as RPE metaplasia, and her vision had dropped to 2100. So in summary, patients with cuticular drusen generally begin coming to see you at an early age. They're very specific. They can be found maybe 2 decades earlier than the standard age-related degeneration. However, they can get the same late complications as anybody with drusen and other problems with the RPE Brooks membrane complex. What you really need to be careful of is don't confuse vitelliform lesions with choroidal neovascular membranes. They both can be creamy colored, they both can be yellowish, they both can have subretinal elevations on the OCT. So this is where a careful history can separate those two. There are some scattered papers out there that show that anti-VEGF can help on these, but they probably would change regardless. There's no good controlled trial on this. Also, they do get late choroidal neovascular membranes, so you don't want to miss the boat on that. And also, if they do have these vitelliform lesions, they can go on to get late atrophy in the area of the vitelliform lesion. And here are some references for you. Most of them are the same as the first talk on cuticular drusen, and there's just one citing the Barbazetto paper.